Everyone, Carlos the Insurance Guy here again. Just today I wanted to give you some basic information on how to understand your health insurance, because the number one reason why people would cancel or terminate their policy is because they don't understand how it works. They don't understand what a network discount is. They don't understand what deductibles, co-insurance, out-of-pocket, co-payments. They just don't understand how all that works. So hopefully this video helps you. It's going to be rather long, so we're going to have to do it in parts. When you guys get a chance, go to YouTube, subscribe to Carlos the Insurance Guy, and you can get more videos and get alerts on new videos to come in the future. But let's start off. The number one benefit to having health insurance is the obvious. You limit your financial exposure. If the world would come crashing down on you, you have some sort of stop loss, some sort of ceiling where you no longer have to shell out any kind of money, right? The insurance company would cover the rest. So that's number one. Number two, when you walk into a provider's office, what is the first thing they ask you? Okay, give me a copy of your insurance card. Why? Because they want to make sure that at least they're going to get paid something, right? If you don't have health insurance, then they're going to say, well, we can't see you here. Go to a community clinic somewhere, and pay cash for it. Okay. Number three is network discounts. When you get a service, there's going to be a bill that's written up by them, the provider. It's going to go to your insurance company, and the insurance company is going to rework that bill. They usually reprice it. They give you a discount, what we call a network discount. They knock it down to whatever the negotiated rates are. Now, what are negotiated rates? Well, doctors, hospitals, providers, they negotiate with the insurance companies, what they want to get reimbursed for services, right? So that's what the network discount. They can put whatever they want on the bill, but when that bill gets sent out to the insurance company is going to say, wait, you can't charge $150 for the service. We've negotiated a rate, between us, if you forgot, to $90. So they reprice it to $90. They get the explanation back to the doctor's office, and the insurance gives you an explanation of benefits, that EOB that many of you have probably seen. They show you the doctor wanted to charge you $150. We repriced it to this much. This is what's left over, and this is what you owe. You have to pay that to the provider's office. Okay. Some more information on network discounts. The number one question that people ask is, well, how do I know how much I'm going to have to pay for this service? There's no way for us to know honestly what you'll have to pay for a certain service, because every doctor is different. Every doctor has negotiated their own contracted rates. Example, if you're a physician that's been in the local area for 25, 30 years, you've established your presence there, everybody goes to you. You have power. That provider has power to negotiate his reimbursement rates. If an insurance company comes to him and says, here, can you be part of our network? Doctor's going to say, yeah, that's great, but here's what I want you to reimburse me for these services. And if the insurance company is smart, they're going to say, yes, okay, that's fine. I'll reimburse you because, 20, 30 years worth of experience, and everybody goes to him, right? Now, if you're a brand new doctor, fresh out of school, you're going to the insurance companies and say, how do I get appointed with you? How do I get contracted with you guys? I want to take your clients that I want to accept the clients that have your insurance. Great. The insurance company's going to be like, great, but guess what? This is what we reimburse for these services. And a new doctor has no choice. He has, okay, yeah, that's fine. I'll take whatever you can give me because I'm just getting started. That's why some doctors, fresh out of school, they become associates at different practices, or they join medical groups like the Advocate Medical Group, here in the Chicagoland area, and a bunch of other ones. But that's a little information on network discounts, network contracted rates. First, that's one of the first benefits that you get is it's like walking in with a membership to Costco, right? You're going to pay all the Costco rates as opposed to just trying to buy it, off the street. Okay. Deductibles. Everybody kind of knows what a deductible is. Give me 1 second here. Deductibles. Everybody knows what a deductible is. When you have car insurance, right? There's a $500 deductible on your car. If you get into an accident with your car, you total it, and you crash it up, and it's $5,000 to repair, you're going to pay the repair facility $500 because that's your deductible, and the insurance company is going to write a check for the other $4,500. It's the same thing with health insurance, except on a larger scale. Now the highest deductible you can get with an ACA plan, I think it's $7,150. So you always have to satisfy your deductible before the actual insurance starts to kick in. Well, in most cases, you have to satisfy your deductible before the insurance company kicks in. So, going back to one of our examples, let's say you go to a doctor because you're feeling sick, and he charges $150. That $150 bill is going to be sent off to your insurance company. Insurance company is going to say, okay, the network discount is $90. That's what you owe. Guess what? That $90, that's your responsibility. You pay that, and that goes towards your $7,000 deductible. Okay? After you satisfy your deductible, then that's when coinsurance starts to kick in. You've heard of 80-20, 70-30, 50-50, 100%. That's coinsurance. That means that you and the insurance company are going to start splitting the money. You guys are both going to start participating in the bills after the deductible. So let's say it's 80-20. They're going to pay 80 cents for every dollar, and you're going to pay 20 cents for every dollar. That's what coinsurance is. Okay? After coinsurance, after the coinsurance starts to kick in, there's something called an out-of-pocket maximum. Okay? With ACA plans, your out-of-pocket maximum includes everything. It includes your deductible, plus how much you've had to participate in coinsurance. So sometimes you'll see a deductible of $5,000. Coinsurance is 80-20, and then your maximum out of pocket is $7,000. So how do the bills get worked? First of all, it's a network discount on every service. Whatever's left over goes towards, you pay that, and that goes towards your deductible. Anything after $5,000, you're paying 20 cents and they're paying 80 cents until you've satisfied or paid out another $2,000, because 5,000 plus 2,000 equals 7,000 maximum out of pocket. After you satisfy your maximum out of pocket, then that's when the insurance company covers everything 100%. Okay, so again, first thing is network discounts. You pay that. That goes towards your deductible. If after you satisfy your deductible, then the coinsurance percentage kicks in, 80-20, 70-30. You pay something, they pay something, until you've shelled out the remainder to get up to your coinsurance, to get up to your maximum out of pocket. If you ever satisfy your maximum out of pocket, then that's when the insurance company should cover everything 100%. Okay, that's the rules for ACA plans. Now, depending on the language of the insurance brochures, the non-ACA plans, you'll see things like $5,000 out of pocket, 80-20 coinsurance, and $2,000 maximum out of pocket. Well, how can that be? Well, what they mean is that you got to satisfy your $5,000, then 80-20, you're going to cover 20 cents every dollar until you satisfied another $2,000. Okay, so just pay attention to your brochure. Pay attention to the language on the brochure. If it says maximum out of pocket, it usually means altogether your deductible plus everything you have to pay in coinsurance totals up to this much, right? If it says coinsurance out of pocket, it just means this is your deductible, this is your coinsurance, and this is your total for coinsurance. This is how much you're going to have to pay after your deductible. Okay, so just pay attention to your language. Obviously, if there's you're still unsure, call your insurance carrier, or call me if I'm your insurance agent, and I'll let you know exactly how it works. Okay, so we've covered network discounts, deductibles, coinsurance percentage, and maximum out of pocket. The next thing we want to talk about are copayments. In some cases, you'll notice that some plans have copayments for certain things, like copayments to go see your doctor, or copayments for medication. Usually what that means is you pay your copayment, and that's it. You get your service, you get your medication, or you get your office visit, unless it states otherwise on your summary of benefits or your policy. But for example, let's go back to our example where the doctor charges $150. It gets knocked down to $90 after the network discount, and you're responsible for that $90, and that goes towards your deductible. Well, if you had a copayment, let's say you had a copayment of, $30 to go see your primary care physician, the bill would still get processed the same way. $150 gets knocked down, whatever's left over, is supposed to be your responsibility, but it's not. You have a copayment for that service, you pay your $30, and that's it. You're done. Right? General rule is that copayment plans tend to be more expensive because the insurance companies, they're not dummies. They know that people that have co-insurance that have copayments tend to go to the doctor more often. So it is what it is. Now, if you don't tend to go to the doctor more often, you're not going every other month or every week, then having a plan that doesn't have a copayment is perfectly okay. You'd rather get a bill of $90, let's say, as opposed to paying, an extra $90 a month in your premium. You don't tend to go to the doctor that often. You might go to the doctor once or twice a year. Might as well save the money in the premium, and you get an extra bill, a little higher of a bill for a doctor's visit, down the road. It's okay. You're still going to come out ahead. Okay. Same thing let's talk about prescription drugs. Sometimes prescription drugs have copayments. What that means is, you're going to go to the pharmacy. If it's a tier 1 generic drug or a level 1 generic drug, and there's a $5 copayment, that means you're not going to pay any more than $5 for that medication. If the contracted rate at the pharmacy is $1, you're going to pay $1. If it's $4, you're going to pay $4. If it's $5, you pay $5. If it's $20, guess what? You're only going to pay $5 because your plan has a copayment for generic drugs. Okay? If it doesn't have a copayment, then you're just going to pay whatever the contracted rate is at the pharmacy. Like providers, like hospitals, every pharmacy can be different. They're running a business, so the medication that costs you $4 at this pharmacy, may cost you $8 here or $10 here or $2 there. There's no telling. You just have to go there and do your research before you actually go out there, or call us and we can tell you where to go get your medication at the most affordable rate. That is pretty much it. That is the basics on how to understand your health insurance. I hope this video has helped you out a little bit. Again, the number one reason why people either terminate or cancel their policies is because they don't understand how it works. If you need help understanding your policy, don't be afraid to give us a call. Give me or my team a call. Subscribe to Carlos the Insurance Guy on YouTube, and get more videos like this. Get knowledgeable about health insurance, and hopefully it does you some good. Okay? Thanks, guys.